I'm Raven, and I'm going to do my treatment summary on client H. Client description. Client H is a 5-year-old male. He is diagnosed in 2018 with a developmental delay and autism. He is also referred to through the school program. His particular elementary school does offer music therapy once a month through a private contractor. However, these students were referred to music therapy, but the music therapist does come to all the special education classes in the school once a week for 40 minutes. From my understanding, the teachers do have some help in doing the referral process, along with for other therapies that the clients are able to be a part of while they're at the school, such as occupational therapy, physical therapy, and speech therapy. Client H is specifically also in speech therapy. Some of his goals that get addressed in speech therapy are answering yes or no questions, receptive language, expressive language, and answering the 5 W's, which are where, when, what, why, and who. Some initial observations that were observed in the initial assessment with client H are his mannerisms. Some mannerisms that he does display are rocking, hand flapping, echolalia, and echolalia. The client echolalia being said is when the client repeats things that are indirectly or directly spoken to them. Client H particularly repeats stuff that is directly spoken to him. However, he does sometimes repeat things indirectly spoken to him. And he also is very detail-oriented and organized, and engages in a lot of repetitive speech and behavior habits. For example, every week before we start our hello song, the client engages in a series of the same animal sounds before we start, right before the hello song. And he does this every week. And that is one of the things that has been observed that he does, is he'll do certain verbal expressions, or he'll do certain like rocking or hand flapping gestures when certain things are going on that are similar. Yeah, and then sensory sensitivity. Client H experiences some sensory sensitivity to exponentially loud noises. He does enjoy music, but he does not display any sensitivity towards any of the instruments that are being played when we have sessions. However, he has been observed to not play things as loudly. He does tend to play quietly on his instruments. Another observation with client H was his behaviors. He is very friendly towards the music therapist and other teachers and other students, and he's very adaptive to change. However, he becomes very easily distracted when other students and classmates are exhibiting behaviors, or when teachers are talking around him in sessions and stuff like that. He does get distracted and is sometimes difficult to get back onto task. Um, when you prompt him, sometimes it takes a couple of engagements to get him back focused on what he was doing before, prior to the behaviors. Um, Decision making and communication and expressive and receptive language. Um, Client H has trouble making decisions and answering questions when prompted with unlimited choices. Um, However, he is able to make decisions when he's given a choice between the two. Um, However, he cannot, has difficulty being able to prompt himself to make decisions. So, for example, um, client H does not verbally express his wants and needs for things. Um, he will point at objects that he wants or objects that he likes and wants to use, but does not communicate what he wants to do with that object, and has not been able to successfully ask, "Can I have?" or state that he wants certain objects. His responses to music. Client H is very responsive to music. He's very musical. Client, and he also enjoys children music. Some of his favorite songs are Wheels on the Bus and the Taco song. Um, he does nod his head and dance and tap his feet and his hands when listening to music. And he is also very engaged in stop and go interventions, and very receptive to that type of intervention style. Some goals and objectives. The first goal and objective is client H will increase his communication. H will respond to yes or no questions at least 2 times in 80% of all music applications by December 9th, 2021. Some of the methods that he will go through, that he experienced when working on this goal and this objective, were movement songs that engaged him in object identification, song books where it was easy to prompt him for yes or no questions, and educational music manipulations that were also able to be adapted to be used to ask yes or no questions that gave him those opportunities to answer yes or no questions. His second goal was to increase object identification. H will ask for objects using their name at least 2 times out of 80% of all music applications by December 9th, 2021. Some methods and experiences that were implemented were to address the object and movements, music and movement, instrument playing, and receptive music listening, where the client was able to identify objects that were being used with visuals, and also make choices on what he would like to implement into the music himself. Yeah. As far as the therapeutic process, the client H was in a group setting. However, a lot of the needs that were addressed in there were also applicable for him. So it was a client-centered approach. And most of his were based on his communication and his speech goals. It was a group setting, and there's usually about 5 to 6 other students in this group, with teacher aides assisting them. And the session plans for these sessions were geared towards major goals for this population, such as communication, impulse control, verbalization, fine and gross motor skills. And some of the interventions that were used to address some of these goals were stop and go, instrument plays, movement songs, um, with guided movements, and drum circles and sing along songs. Some methods and variations. So one of the interventions that were used with to address his objective one, to increase communication, was the toolbox song, upon which the client was given rhythm sticks and demonstrated how to play specific tools. And how it was implemented into the session was to ask the client, are we playing said tool? So we'd tap, tap, tap along as we sing our toolbox song. There are so many sounds that we can make with our tools along. Get out our hammer and stop. And we'd stop and ask the client, well, did we get out a saw? And that prompts, and then I would prompt the client to be, can you say yes or no? Are we playing a saw? And upon which the client could answer yes to playing a saw or no to playing a saw. And that was a really easy way to implement yes or no questions into the session. Also with this, it was also easy to prompt the client for just, are we playing a hammer or are we playing a saw? And they can make a decision between the two. Or sometimes to make it, to ask the client if they could identify what tool we were playing, I would play just this one, or just the saw, or the paintbrush for the client. One intervention that was done to work on objective 2 and goal 2, to increase verbal identification, was to use characters for Down by the Bay. And the client would see the character. So the first character would be a ghost eating toast, was the rhyme. And the goal for the client was to at least identify either the ghost or the toast. So the client was given egg shakers, and they would play down by the bay where the pumpkins grow. Back to my home, I dare not go. But if I do, my mother will say, and stop. And the client, I would point to the ghost on the poster board eating toast and ask the client if they could identify the ghost. And we would do this a couple times. And I would ask the client, oh, what is this character? And the client had the opportunity to say ghost. Obviously, before we started the intervention, we would go through all of the characters so the client was aware of each picture and what they were. And even if they couldn't get the full rhyme, they were still achieving object identification by matching the picture of the ghost with the word ghost, or the picture of toast with the word toast. So some progress. Um, some musical progress that the client exhibited was his increase in musical expression and awareness of others during musical intervention. Um, the client was very began to open up more. He the more he's done music therapy, and he's increased in his musicality a lot. And is also very aware and willing to listen to others in the group, um, and aware of giving them their turn to express themselves. Um, and he listens very attentively to the other members in the group. Um, the client has also become very responsive to the music therapist in the group, um, and will engage with them. And it's easy to focus back on tasks the more he's engaged with during musical intervention. For in regards to non-musical progress, um, the client has shows an increase in his ability to identify objects. Um, he does still require some prompting, but after multiple repetitions, he's always able to identify some objects, um, with just having that memory built up of the repetition. So repetition is very receptive to him with the object identification. Um, Client H does still have some difficulty with yes or no questions. He is able to answer some yes or no questions, but not consistently enough to achieve the goal. However, there is lots of progress in this goal area, but more work is needed to accomplish some of those goals. Um, Also, for further recommendations, the client would benefit from continuing his music therapy sessions once a week with his group. Um, I think he would benefit from this because he does have good group cohesion, and does work well in groups. Um, However, I think it would also be beneficial for this client to also engage in some individual sessions. I did have the client for one individual session, and having that hands-on and individualized moment with the client, and that extra attention was very helpful to him. And it also allowed for me to observe some things that I didn't wasn't able to observe and gather in the group. During that individual session, I did notice that there could be some coordination things that could be worked on that could also be other goals of the client. He does display some awkward movements and does have difficulty with his range of motion and crossing midline sometimes. So that is another goal area that could be worked on that doesn't directly correlate to his speech therapy that he's in. And also, another future goal would be memory retention. Um, the client does have difficulty remembering things in a sequence. Um, and we worked on this through a lot of movement songs where there was like three consecutive movements that were broken down and then all put together at once. And then also, I think this would also help with progress in towards his object identification and goals and objectives, just so he is able to retain more words, and knowledge about the words and the picture and focusing them, matching pictures with the words, um, and then just creating that muscle memory to prompt him, oh, there's ghost. That's a ghost. So verbalizing ghost when he sees a ghost, or verbalizing toast when he sees toast, um, and things like that. However, the client has shown a lot of progress in being able to ask for colors, which was observed um, in his progress. He is able to ask for the color yellow when choosing scarf or when asked what color for scarves. So there is some progress being made there, but I do feel that a good recommendation would be maybe to have some individual sessions, um, so that he is able to get more specialized treatment in his music therapy sessions. Um, yeah, but thank you guys for listening. And I thank you. Bye.